Hello and welcome to Beyond Markets, where we bring you up to speed on development outcomes in Africa. I'm Kenneth Igbomor, and I'm not alone today. I'm joined by my colleague Fifi Peters. He joins me from Johannesburg. Fifi, how's it going down with the lockdowns in South Africa?
Yeah, Ken, we have just passed the halfway mark of our 21-day lockdown. We're supposed to end it on the 16th of April. Of course, a lot of talk around whether we'll get an extension or not, but so far, so good. We've got around 1,683 cases of coronavirus, of course, the largest here in sub-Saharan Africa, but it looks like government is hands on the ground, really trying to contain the spread of the virus any further.
Well, in Nigeria, we're seeing a ramp up in cases because if you look at the figures from the end of March up until just yesterday, we had, just in April alone, we've had 99 cases compared to the development we've seen so far. So definitely a lot of work going to be done there. But on today's show, we'll explore the role the African Union's Development Agency-NEPAD can play to help African countries tackle the impact of the coronavirus outbreak. You can join the conversation on social media. You can also send your comments using the hashtag Beyond Markets. Now, the African Union's Development Agency says Africa has a window of opportunity to learn from the patterns, trends, and experiences of high-risk countries that designed and implemented responses to slow down the spread of the COVID-19 pandemic and protect populations from the socio-economic adverse impact. We have with us joining us Ibrahim Mayaki. He's the CEO of the African Union Development Agency-NEPAD, and he joins us now to share the agency's response plan. Thank you so much for joining us on the show, sir. But before we get into the plan, though, I'd like to get your assessment of the development so far.
Ibrahim, just to pick up where my colleague was there, I mean, the African Union, we do understand that you've launched a new initiative to fight COVID-19, but how have efforts to contain the spread of the virus been working so far?
Well, it's important to mention that there are three levels of interventions, and these three levels of intervention are complementary. They complement each other. You have a national level where direct actions are being taken in order to contain the spread of the virus and to provide the necessary guidelines in order to do so. You have a regional level where you have regional strategies and sharing of best practices between countries. And then you have a continental level. And at the continental level, at the center of the system, in order to tackle COVID-19 is the African Union CDC. And the African Union CDC is really the platform which gathers all the critical interventions that need to be made continentally and which gives to the countries the necessary technical advisory services in order to tackle the spread of the virus. And it is not well known, but the African Union has really put its house in order. I mean, they organized very quickly, 1 month ago, a conference of African health ministers. Decisions were taken, measures were framed through the CDC. Secondly, an assessment of the economic impact of COVID-19 was done, which allowed the African finance ministers to build a common position that they will table at the spring meetings of the IMF and the World Bank, just like other regions are doing. So the house is in order, and in our specific case, which is AUDA-NEPAD, the African Union Development Agency-NEPAD, very quickly, 3 weeks ago, we defined a response action plan focused fundamentally on 4 issues: health service delivery, research and innovation, education, and food systems. It's very practical because it digs in what we already do. As you know, we are quite advanced in framing Africa's pharmaceutical strategy through the PMPA, the African Pharmaceutical Manufacturing Plan, and we are targeting local production. Because in the global context in which we are, where global value chains are being disrupted, where competition to get medicine and equipment is increasing, Africa needs to not only think in terms of short-term actions, but also in terms of mid and long-term. And we need to reassess our regional value chain so that we can produce locally, and ventilators, masks, medicine, etc.
Right, and Ibrahim, so 3 weeks into the launch of the COVID Response Action Plan, what has the buy-in from member states been so far? Of course, as they at regional level try to continue with their own plans to really combat the economic fallout that COVID-19 is likely to bring.
Well, there are two factors which have allowed a high buy-in. The first one is coordination. And as I told you, very quickly, from the very start of the spread of the virus, the African Ministers of Health met, they constituted subgroups, and they are reporting every day to the African Union CDC in Addis. So coordination is the first factor of buy-in. And the second factor is consultation. I think there is a systematic consultation going on. So what is our role as a development agency in that regard? Is to support the African Union CDC by bringing COVID-related issues which are going to impact importantly on the post-COVID repercussions. Let me give you an example. The global value chains in agricultural products are totally erased today. And Africa is an importer. We import around $50 billion of food products. Given this new context, we need to rethink very quickly on how we readapt our regional value chains in terms of food production. And it has a direct impact on COVID-related issues because in order to ensure human capital, health development, you need to secure the issues of food security. So that's one example. And the second example on what is being done very concretely is the gathering of pharma producers in the continent that will link with investors and policymakers so that we can tackle the issue of local production of pharmaceuticals. So these are two examples. I could name other examples. We have done a very sound construction of measures in education so that we can promote e-learning and e-learning through communities of practices. So these are very practical things that we are doing.
And I mean, in terms of making the practical actually get realized practically on the ground, I imagine you'll agree with me when I say that a lot of the plans and ideas that you have in place will need money and will need a lot of money. Right now, there's concerns that the continent doesn't quite have enough to fund things like medical supplies and face masks and testing gears and ventilators and the like, just to address the initial health issue being the COVID-19 virus. What kind of firepower is the development agency currently sitting with on its balance sheet?
Well, you should position the development agency within the African Union context. As I was saying previously, some actions will be taken continentally, and in that regard, a COVID fund has been created at the level of the CDC, and this COVID fund is mobilizing resources in an accelerated manner. Now, if we look at the national level, the main preoccupation that exists is the fiscal space which has been constrained at the level of all our governments. And the response that the African finance ministers have given is that there should be a debt alleviation, and these are the negotiations that will take place with the IMF and the World Bank during the spring meetings, which are going to take place mid-April. We are not in a situation where, as the Federal Reserve of the U.S., we can print money. So we have to focus, and that's what they are doing, whether it is the European Central Bank or the Federal Reserve Bank, they are creating money. But in our case, we need to look carefully in increasing our fiscal space so that we can have responses that can help fund our health issues. And that brings me to a critical point, which is we shouldn't forget the main frameworks that Africa has, like the Continental Free Trade Area. This is an opportunity which shows us that the more we will be regionally integrated, the better we will be in a position to tackle these pandemics and other critical issues that can be raised in the future. National solutions won't be the answer. Now, in a hurry and under stress, in order to provide urgent responses, we need to have these mechanisms. But in the mid and long term, we need to rethink totally the way Africa is building its economies. And that has to be focused on our internal regional markets so that we are not caught by surprise and so that we can have our own solutions for our own problems.
And I introduce the show.
Secondly, in terms of resources, we need to pool resources at the regional level so that we can have the proper and optimal allocation of resources. Let's take the issue of manufacturing of ventilators. I mean, regional solutions are better than national ones because you will have economies of scale. Masks, tests, all these products and equipment need to be taken under a regional solution framework.
Ibrahim, let's talk about that April meeting, mid-April meeting that you're hoping to have with key lenders like the World Bank and the IMF. We've had a lot of proposals being put on the table to encourage African governments to get some form of fiscal room because, as you rightly say, we're not in the situation as our developed central bank counterparts where we can just print money. There's been solutions on the table regarding freezes on interest payments to existing loans. There's been solutions on the table regarding a form of debt forgiveness or debt pardon, and also allowing other countries who are currently operating under sanctions to get access to international lending from the World Bank and IMF because of the fact that we're in a health crisis. So just help us understand exactly what proposals you will be putting on the table on behalf of national governments here on the continent.
Thank you. It's a good question. First of all, 2 points of clarification. The World Bank and the IMF have spring meetings every year in the second week of April, at the end of the second week of April. And the spring meetings gather all the finance ministers of the world. Evidently, the next spring meeting, which is 15th of April, will have a main theme of discussion, which will be how do we respond financially and strategically to the spread of COVID-19. African countries, Latin American countries, and some Asian countries have a high level of debts. That reduces their fiscal space. So in order to increase their fiscal space, mechanisms looking at debt reduction through different ways it can be on interest, it can be on the capital, needs to be framed. But beyond that, and I think that will happen because the decisions, well, the intentions of IMF and the World Bank are quite positive in that sense. The chairperson of the African Union Commission had a long conference call with the Director General of the IMF 2 days ago. The World Bank has been also having talks with African ministers of finance. So I think this issue will be relatively well solved. And what the African finance ministers are aiming at as a target is between 150 and 200 billion dollars. But my issue is the increase of that fiscal space. The input of resources at this moment do not solve the long-term issues. This is an opportunity to rethink Africa's development, its strategies, its financing, the way it takes decision the way the African Union takes decision as a common body. We are shown a reality, and that reality is that every region comes back to its own dynamics. Europeans are trying to have a coordination. The rest of the world is trying to coordinate. Some countries are going at it alone. In Africa, we have a huge advantage of having concrete mechanisms of coordination and having frameworks which are defining what should be our future through the Agenda 2063, through the Continental Free Trade Area, and so on. So we need not to forget about them and to increase our capacity to implement them. Otherwise, we might be brought back in a situation of dependency that will severely affect our development trajectories.
Dr. Mayaki, Kenneth here. Interesting what you said, about the Agenda 63 and the work that is ongoing, and also, planning the development for Africa. I know you guys have been doing quite a lot of work on that space. But at the heart of this is, mobilizing human capacity and expertise to deal with the challenges that we're seeing now, and even what we even perceive will happen in the time to come. But I'd like you to speak to how that strategic thinking and mobilizing human capacity and expertise can also help, solve some of the challenges that we can see.
Absolutely, Kenneth. And there are two things that are being rediscovered, but which were already enhanced and highlighted by many development thinkers. The first one is you cannot beat COVID-19 if you do not empower local communities. The empowerment of local communities is what will make social distancing acceptable, is what will make wearing masks acceptable. It's what will make confinement acceptable. If you do not go through local leaders in empowered communities, whatever centralized governments are saying is not going to be effective. So we rediscover the importance of communities, local communities, their power, their capacity, and that's a good thing. The second issue is that we rediscover the importance of investing into science, technology, and innovation. And we discover that Africa has quite a critical mass of biologists, virologists, epidemiologists, and we count on them. And the African CDC is liaising with about 40 national CDCs composed of these talents. So we need the human capital through the local communities which should be empowered, and we need the human capital through the expertise of scientists, virologists, biologists. These are two things that we rediscover during this crisis.
But still building on what you just said, now I understand that you, the AUDA-NEPAD has been working, especially around the pharmaceutical manufacturing plan for Africa. I would like to know how this first is going to, how it has been conceptualized, and then definitely the implementation. Because definitely we look at the challenges in the, we're seeing that a lot of the APIs for most of the drugs that we have are imported from other countries.
Yes, we import the vast majority of our products, medical, pharmaceutical products that we consume. But we have made quite important progresses because, as you know, in order to boost local manufacturing, we needed to solve soft issues like regulatory frameworks. So we have gone a long way in harmonizing national regulatory frameworks in order to have regional regulatory frameworks in order to create the economic space where producing pharmaceuticals would be a good business and would respond to the local needs. So this has been done. We have more and more small and medium enterprises producing pharmaceuticals in the continent. The question is, how do we support them financially so that they can have access to capital? And in order for them to have access to capital, you need to provide them with guarantees. That's the first point. And the second one is, how do we make sure that the regulatory frameworks allow them to produce and minimize the risk that they are facing? So, and at the same time, create a space where clinical trials can be efficient, effective, and recognized with the necessary standards. All these issues have been put in place. Now, that needs to be accelerated in order for us to reduce our dependency in terms of imports of pharmaceuticals. But I can tell you, whether it is in East Africa, Southern Africa, or West Africa, these regions have moved quite fast in uplifting the constraints regarding the regulatory frameworks. And we see a booming of small and medium enterprises. This has to be accelerated through a role of the government, which is to support by facilitating access to credit and by making sure that it does provide the necessary environment for them to flourish.
All right, Dr. Mayaki, in trying to put together the response plan so far, I understand when you look at how all the global development finance institutions and agencies have been responding, we kind of look at the fact that it's addressing some of the short-term needs of the COVID-19 pandemic. But I'd like you to speak to more around the medium to longer term, even about planning, beyond the pandemic.
This is the most important question. We will get through the pandemics. The numbers, will hike, and then we'll have a plateau, and then there will be decreasing cases. We'll get through it. But the main question, as you are rightly saying, is in what conditions will we get out of the pandemics? And this has to be thought about right now. What are you seeing all over the world? You see Americans going on a tarmac where you have a plane going to another country and paying cash equipment which has already been paid by this country. I'm saying Americans, but it could be every nationality. You see a heightened competition where nationalism is the key word and the key behavior. Most of the countries are trying to, fight for their national interest. And you see it systematically. The same happens that's why the global value chains are distorted. The kilo of, in a cargo now, the price of the kilo in a cargo plane has been multiplied by 4. So you see a change in the context and the reality when nationalism is taking really the reign of the situation. Regarding Africa, we have been saying for a long time, our solutions are not national because these national solutions have an intrinsic limit. Our solutions are regional. The better we cooperate regionally, the better we move forward. And on the basis of our comparative advantages nationally, we can have a regional coordination in West Africa, in South Africa, in East Africa. So it is time for us to think in the acceleration of our regional frameworks, in agriculture, in pharmaceuticals, in trade, in logistics, in health, in education. This is the time to think about it. The only way that will allow us to get out of this situation in better conditions and to strengthen our muscles and our brains will be to go towards regional solutions. I'm happy about two facts. The first one is that, for example, the health ministers, all the African health ministers are working together, and all the CDCs are working together. So they learn how to behave together. They learn how to have a common response and how to share best practices. The second thing is that the finance ministers are on the same line because they will have the responsibility to implement the Continental Free Trade Area, which will allow a free movement of people and goods. And those who were thinking that the Continental Free Trade Area was a kind of idealistic scenario realized that there is no more realistic scenario than this one, because it's the one that will allow us to survive after COVID-19.
Thank you so much for your time on the show. Very interesting insights you provided on this topic. Definitely, I'll be speaking to Ibrahim Mayaki. He's the CEO of the African Union Development Agency-NEPAD. And that's all we have on Beyond Markets on the show today. Fifi, thank you so much for joining me on today's show, Fifi. And you can watch the show at 5 p.m. West Africa time daily and have access to all episodes of Beyond Markets on our website. That's at cnbcafrica.com. You can also stay engaged with the hashtag Beyond Markets and let us know what you think about the topics that we discuss. And from me and the team, have a wonderful day.